Good morning and welcome to my session. This is a post-SGT question or quiz on pancreatic disease. Question number 1. Which of the following physical findings may indicate severe necrotizing pancreatitis? The answers are A. Jaundice, erythematous skin nodules, fever, hypotension. The answer is B. Erythematous skin nodules. Question number 2. The most useful imaging method for pancreatic cirrhosis: A. ERCP, B. CT scan, C. Endoscopy, D. barium meal, and E. MRCP. The answer is B. CT scan. Question number 3. What are the complications of chronic pancreatitis? A. Malabsorption, B. Diabetes mellitus, C. Chronic intractable pain, D. Pancreatic cirrhosis, E. All of the above. The answer E. All of the above. Question number 4. What is the most common risk factor for pancreatic cancer? A. Obesity, B. Chronic pancreatitis, C. Smoking, and D. Diabetes mellitus. The right answer is C. Smoking. Question number 5. Which of the following are not parameters to assess the severity of acute pancreatitis, either Ranson or Glasgow score? A. Age, B. White cell count, C. Serum amylase, D. Serum calcium, E. Blood urea, and F. Lactate dehydrogenase LDH and aspartate transaminase AST. And the right answer is C. Serum amylase. Question number 6. The radical curative operation of pancreatoduodenectomy for carcinoma head of the pancreas, periampullary carcinoma, or the lower end of the CBD goes by which name? A. Millen, B. Billroth, C. Whipple, D. Wertheim, and E. Obridane. And the right answer is C. Whipple. Question number 7. Which of the following inherited disorders increases the risk of pancreatic cancer? A. Hereditary non-polyposis colorectal cancer, B. Familial adenomatous polyposis, C. Von Hippel-Lindau syndrome, and D. All of the above. And the answer is all of the above. Question number 8. The differential diagnosis of a mass lesion in pancreas includes all except A. Lymphoma, B. Neuroendocrine tumor, focal chronic pancreatitis, autoimmune pancreatitis, and E. None of the above. And the right answer is E. None of the above. Question number 9. What is the relative 1-year survival rate for pancreatic cancer? A. 12%, B. 18%, C. 24%, and D. 30%. And the answer is D. 24%. Question number 10. What is the most sensitive and specific diagnostic test for pancreatic cancer? A. CT scan, B. Endoscopic ultrasound or EUS, MRI, and PET scan. The answer is B. Endoscopic ultrasonography or EUS. Okay, for the following two questions, pick all the correct answers. Question number 11. Which of the following statements are true? The pancreas weighs 200 grams. B. The uncinate process lies behind the superior mesenteric vessels. C. Vast majority of pancreatic tissue is composed of exocrine acinar tissue. D. Of the endocrine cells, 75% are beta cells, 20% are alpha cells, and the remainder D cells. E. The accessory pancreatic duct drains the head and the uncinate process. The answers are B, C, D, and E are true. Question number 12. Which of the following statements are true with regard to pseudocyst of the pancreas? A. A pseudocyst occurs within the first week of onset of acute pancreatitis. B. They can be confused with cystic neoplasms. C. The majority of them require surgical intervention. D. Gastrointestinal bleeding may be a complication of pseudocyst. And E. They can arise after blunt trauma to upper abdomen. And the right answers are B, D, and E. Okay, this is a case scenario. Question number 13. A 65-year-old gentleman presented with a dull aching upper abdominal pain radiating through to the back and worsened by eating. He also noticed yellow discoloration of his skin and has lost weight. In his past medical history, he was diagnosed with diabetes mellitus 6 months earlier. A CT scan revealed a localized mass lesion in the head of the pancreas with biliary duct dilatation. All the following statements are true except A. CT scan guided biopsy is needed to confirm the diagnosis. B. There is little evidence of benefit from routine biliary stenting of jaundice patient before resection. A diagnosis of pancreatic cancer should be considered in unexplained diabetes in patients over the age of 50 years of age. Gastroduodenal artery encasement is not a contraindication for curative treatment. E. Whipple's operation is the standard operation for cancer of the pancreatic duct. And the right answer is A. A CT scan guided biopsy is needed to confirm the diagnosis. Okay, we come to the final question, which is a EMQ, extended matching question, question number 14. Choose and match the correct diagnosis given on the left here with each of the scenarios given on the right. Scenario number 1. A 65-year-old man complains of intense itching and jaundice of 6 weeks duration. He has upper abdominal discomfort and has noticed of late the urine is deep yellow in color and his stools are pale. He has some weight loss, and on examination he is deeply jaundiced with scratch marks all over his body. Abdominal examination reveals a globular discrete mass in the right upper quadrant. Which is the right diagnosis for this patient? The right answer is C. Carcinoma head of pancreas. Scenario number 2. A 10-year-old boy presents with upper abdominal pain of 2 weeks duration. This is associated with upper abdominal distension, nausea, intermittent vomiting, and some weight loss, which he puts down to his loss of appetite. On abdominal examination, he looks unwell, with a smooth mass in the epigastrium, which is tense and does not move with respiration. There's bruising over the skin of the epigastrium, and when questioned about it, he says it was a result of his falling off his bike and handlebar sticking into his tummy. Choose the correct diagnosis for this patient. The answer is D. Pseudocyst of the pancreas. Scenario number 3. A 45-year-old woman who is on waiting list for laparoscopic cholecystectomy presents as an emergency with severe epigastric pain radiating to the back of the abdomen of 3 hours duration. She has nausea, has vomiting a few times, and retching. And on examination, she is tachypneic, tachycardia, and a blood pressure of 100/10 by 60 millimeters of mercury. She is slightly icteric. Abdominal examination reveals a Cullen sign with extreme tenderness all over the abdomen with rebound and rigidity. What is the correct diagnosis for this patient? The answer is A. Acute pancreatitis. Next we come to scenario number 4. A 55-year-old man complains of intermittent jaundice associated with itching. This is associated with anorexia, weight loss, and upper abdominal discomfort. On examination, the patient is anemic, has stretch marks all over his body, slightly jaundiced, and has a gallbladder that is just palpable. What is the right diagnosis for this patient? And the answer is E. Periampullary carcinoma. Scenario number 5. A 50-year-old male patient presents with dull aching pain in his epigastrium and umbilical area, radiating to the back for the last 6 months. He has episodes of exacerbation of this pain which last for a day or two. This is associated with nausea and occasional vomiting and diarrhea most days. He has lost some weight over this period. 2 months ago, he was diagnosed with type 2 diabetes and is on oral medication. He admits to more than average alcohol consumption, and the clinical examinations shows no abnormality except for generalized tenderness. What is the right diagnosis for this patient? And the answer is B. Chronic pancreatitis. And these are the answers to the various scenarios. We now come to the end of this session. For more information on these pancreatic diseases, please scan this code for your link to talks on pancreatic disease. Thank you.